All right, everyone. We're going to go ahead and lecture in the EMT lecture series over Chapter 2. This is over workforce safety and wellness. Let me tell you this. You might think as an EMT student, this is boring. I don't need to know this. But I will say this is actually a pretty high yield chapter. And if you don't know, about 10 to 14% of your national registry exam is made up of what's called EMS ops. And this falls underneath the category of EMS ops or EMS operations where they could ask you what's the difference between eustress and distress, and what's PTSD, and what's a fomite, and all these things that we're going to talk about in this lecture. So it is kind of important to know these and not write them off as, I get it's not blood, guts, and glory, the exciting stuff that we want to be EMTs for, but it is still high yield. So do keep that in mind as we progress through this, that this is very testable questions. Now, let me tell you this. Unfortunately, it's not the most exhilarating material, and I really don't like reading off of slides to students, but in this case, I'm going to kind of have to because I hate to use the word regurgitate, but this is kind of regurgitation type material where you just got to take in a bunch of information and be able to spit it back out on an exam. But lastly, one thing I'll say, and I'll say this over and over again in my lecture today, is EMS professionals don't do a good job of taking care of ourselves. And, in order to take care of others, we must first take care of ourselves. And you'll see this a lot in the industry, right? You'll see burnout and obesity and sleep apnea and divorce rates that are really high. And it's really unfortunate because as a profession as a whole, we do a really good job taking care of others without objection. Routinely, we take care of others. But this chapter, do keep in mind that it's really hard for EMS professionals to take care of themselves for a variety of reasons. And this chapter is trying to kind of tackle that. And so I think it's important in the workforce as an EMT and a new EMT or paramedic. But I also think that it's important for us to know it shows up on exams. So it does have an academic relevance to it that it shows up on exams. Okay. So here we go. Now, we have to protect ourselves from infectious disease. Basically, infectious disease can be a lot of different things, right? This could be tuberculosis, HIV, hepatitis, flu, COVID. The list goes on and on and on of what infectious diseases we could grab or get while doing this job. So they want you to know quite a bit about how these diseases are spread and how we can prevent them, and that a big chunk of this lecture focuses on that. So, communicable diseases, this one, can be spread from person to person or from one species to another. So, for example, COVID-19 is spread from person to person, right? And we're no stranger to that at this point, living in year 2023. But an example of one species to another person or to another species could be Lyme disease. You know, rickettsia. That's another type of tick-borne illness. Rocky Mountain spotted fever. The list goes on and on. Malaria, Zika, West Nile virus. There's a lot of zoonotic, bubonic plague that get passed on from one species to another. So that's just something to be aware of. That it's not just person to person. It can be from a vector, right? Like an animal or a parasite that shares it to humans. Now, we can reduce our risk of infection by immunizations. What's immunizations? You've probably had to have these, like you have to have meningitis to be in college, okay? Hep B, you have to have Hep B to be in this program, like the Hep B vaccine, I should say, not the virus. You have to be vaccinated for Hep B to be in this program. And this is in good faith, right? So, like our clinical contracts say, oh, we'll take your students, but in order to be in our hospital, they need to be vaccinated, and that's why this exists, okay? So immunizations can help us build up antibodies to the antigens that we're trying to defend ourselves against. So antibodies are these little things that float around in our blood to protect us from antigens. Okay, so it's kind of worth knowing. And we get antibodies from past exposures or from immunizations. Okay. Now we have protective techniques like hand washing and wearing gloves and gowns and goggles and masks and all that good stuff. But I can't highlight enough that you will see that hand washing is a very effective way to prevent the spread of diseases. Okay, wash your little nasty hands and wash them well. This becomes a problem though because we don't have running soap and water in the back of an ambulance. So this becomes like a me. So at a minimum, wash your hands in the hospital. and at the station and stuff like that. Make sure you're practicing good hand hygiene. Okay, so um, I want you to know this. I'm telling you about all these scary diseases that we encounter. The risk of you catching these diseases when using protective measures and best practices, it's very small, as long as we're using best practices. So, I mean, don't drop out of EMT school in the second chapter because you're afraid of diseases. That's not really what's happening here, but I'm just letting you know uh, that without the proper precautions, of course, you could get these communicable diseases. But, if we follow the rules and procedures, then you're pretty safe for the most part, okay? So yeah, we have to properly clean our ambulance in between patients to, limit illnesses and transfer of diseases. And you need to perform other providers who may come in contact with a patient of potential risk. Yeah, this is important. If you know a patient has tuberculosis or, COVID even, you might want to avoid other providers like the receiving nurse and stuff like that. Like if you don't know, tuberculosis is hemoptysis, which is coughing up blood, and night fever, night sweats. That's like a dead giveaway, especially in like a homeless person. So you might want to like, oh, hey, I think this patient has TB when you're calling in your radio report. So anyways, all contagious diseases are infectious, right? Contagious means that it can be spread. And infectious means it can invade a host. We are the host, right? But not all infectious diseases are contagious, okay? Um, so that is kind of a confusing way to say this, but contagious diseases are ones that are spread, but infectious diseases don't always have to be spreadable, if that makes sense. Trying to think of an example of that. Most of these are contagious, and that's why I'm struggling with this. Uh, yeah, I guess an example would be like uh, toxoplasmosis. So basically, if someone drinks infected river water, right, they could they're going to get sick, but just because you live in the same house as the person that has toxoplasmosis, uh, doesn't mean that you're necessarily going to get sick. Right? I mean, that's not a great example, but that is an example. So, anyways, a pathogen like a microorganism is a microorganism capable of causing disease in a host. So this could be a parasite, this could be a fungus, this could be a virus, this could be a protein that's misfolded. They're called prions. This could be bacterial, right? It could be a lot of different things. It could be a combination of that. So that is a pathogen, okay? And a host is the organism or person that's invaded. And students get lost in the sauce on this one. So when you go to a party, whoever's hosting the party is welcoming you in their home, okay? So they're hosting you. And so if I'm a host and a pathogen comes into my home, my body, then I'm hosting them. So that is what a host is. So don't get lost on that. It's really quite simple. You could also even think of like a restaurant host, right? They're welcoming you to the restaurant, right? They're holding you in the restaurant, okay? So one way to think of that. Now, contagious disease, they're expect this is tested, okay? They want you to know how things are spread. So direct contact is quite obvious, right? You're directly in contact with someone who is contagious or infectious. So, an example would be if you make direct contact with a dirty needle that just came out of a patient with hepatitis B, that's an exposure of direct contact, okay? Now, in indirect contact, same scenario, you have a patient with Hep B who bled on the stretcher. You're cleaning up the stretcher, and then you're not wearing gloves, or your gloves have a hole in them, or something like that, and you have an open sore on your hands or fingers, and that would be an indirect contact, and you're like, what? But it's still the patient's blood, and I directly touched it. I know that's where it gets confusing, but think direct contact comes at the exact time direct exposure from the patient. Indirect contact, this is usually after the fact. It's indirect. And a word that you'll hear thrown out with this is called fomites. Okay? Not me being fancy, it's in your book. Fomites is basically like transfer of like a pathogen by touch. So this could be like a TV remote or a light switch or a dirty stretcher, or it's nasty in an ambulance, the steering wheel, or a door handle or something like that. It's something by touch. That is indirect contact, and that's called fomites, okay? So airborne transmission, this is obvious, someone who's coughing or sneezing. So that's how that would be spread, pretty obvious. Foodborne transmission, we don't see a whole lot of this as a risk to EMS providers, but foodborne transmission, I'd say the more common one you need to know is like Hep A and Hep E. Okay, so this is hepatitis that's spread by food. So specifically like fecal oral. So yeah, that's an example of like foodborne transmission of diseases. Okay, there's a lot of other ones like Shigella and E. coli and Staph aureus. There's a whole list of ways we can get sick from food. And I gave you some examples of vector-borne illnesses. So like malaria, is a great example, and Zika. Both of these are spread by mosquitoes, and Lyme disease. This is spread by a tick. You know, the list can go on and on with vector-borne illnesses, but these are by vectors. These are by parasites or animals that kind of go out and they do their little thing and they get you sick at the same time. So those are vector-borne illnesses. Okay. They're showing you example of someone not having good manners and sneezing with their mouth open. So of course you want to cover your mouth with your elbow or sleeve. Don't be spreading your nasty little airborne aerosol germs all over the place if we can avoid that. Someone blowing their nose and someone covering their cough properly. Good for her. Or sneeze, whatever that is. So moving forward, we get trained in bloodborne pathogens. Okay, the American Heart Association has like a little bloodborne pathogen course. If you work in a hospital, especially, they're going to make you do additional training on this. But just in general, we're trained on how to handle this, and this is required by OSHA. I think OSHA stands for Occupational Safety Health Administration, and it's like kind of workplace safety. So this does apply to EMS. It's not just construction. So just be aware. Um, so basically, this thing called universal precautions, right? We assume that every person we come into contact with is infected. So this is why we wear gloves on all our contacts, and this is why you know you got to limit. You assume that all bodily fluids are infected. So you don't, you protect yourself and assume that everyone is infected because here's the deal: patients may not know that they're infected, right? So like someone could have HIV and not know it, or not disclose it to you. Someone could have COVID and not know it. That's pretty common. So just be aware. And the good thing to do is if you are exposed, right? You need to notify your chain of command, and usually there's someone called a designated infectious control officer. In Texas, at least, this is required for every EMS agency. It's additional training you do. I did this. It's like a week-long course. It's a lot of administrative work, really. But it talks about like what happens if your workforce someone on your team gets exposed. What do you do? Who do you report it to? What paperwork do you do? All that stuff. So, anyways, you want to report that up to chain of command. But before we go further, I want to talk about what an exposure is. What's exposed? So, ask yourself this: is it an exposure to clean up blood off the cot? Is that an exposure? No, it's not. If you're wearing gloves, no. What would be an exposure is like a patient spitting blood in your eyes or in your mouth, or a glove breaks and you have an open wound on your finger, or you get a dirty needle stick. Those are exposures. So be aware that being around blood with the proper PPE or around a sick person with tuberculosis with an N95 mask on you, that yeah, you're around the patient, but that's not an exposure. An exposure is when you're like truly exposed, right? So I could turn this all around, right? So tuberculosis, it's an aerosol transmitted disease. So they cough a lot. So if you're wearing a specialized mask called an N95 that filters out 95% of particulates in the air, then you're protected from tuberculosis. Okay, so that's what we do. When someone has tuberculosis, we wear an N95. But if you were to wear a or have a tuberculosis patient and not wear an N95, then that would be an exposure. So the hint being here, when you're not wearing the proper PPE or when it like punctures your skin, you're no longer protected, i.e., right? Then you're exposed. So I just want to clarify on that, okay? Now, again, wash your hands. I think hand sanitizer is great, but there's nothing that'll beat some little warm water and soap action for about 30 minutes, or I'm sorry, 30 seconds. So just be aware, wash your hands. It's very, 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 very effective way to reduce your exposures, all right? Your risk of catching disease. Wash your hands. It's very important. All right, so gloves. We're going to show y'all in class how to properly don and doff gloves. Right, take them on and off. But gloves are great. Don't be buying your lunch lady gloves. Make sure you're wearing good chemical protective gloves that are rated for EMS. We saw a lot of this in COVID where glove manufacturers couldn't keep up, and people are buying like lunch lady food gloves to go run EMS calls. Granted, I get it was an emergency, but make sure you're wearing real gloves and they're good gloves. Okay, and you should change your glove between every patient. I would also say change your gloves between entering the cab of the ambulance and the patient compartment. You really want to keep the cab clean, with all the nastiness. Keep it in the back. Don't be putting that up there where you're spending a good chunk of your shift. So yeah, just be aware of that. Now, eye protection, goggles really are best. I will say prescription. I wear prescription eyeglasses. They're not adequate. First off, they're not rated for that. They're not really designed for that, and they don't wrap around your eyes like goggles do, so they don't really protect you. So if you see this on an exam, are prescription sun or eyeglasses or sunglasses adequate for PPE? The answer is no. They're not. Okay. So just keep that in mind. Face shields also protect. Big fan of the face shield, especially during COVID or like a patient with meningitis or something like that. I like to wear a face shield. Now, gowns, we wore a lot of these in EMS. These really suck in the summer in Texas, but they're helpful. And let me tell you this: I ran a call. I don't tell a lot of war stories, but basically, this guy shot himself in the head. We knew that. We knew we were going to have to work him. So we were staging, and what staging is where you pull your ambulance over down the street or away from the address, and you're waiting for the police department to say, "Hey, it's safe to come in." So while we're staging there, I'm like, oh, we should probably put on a gown because this guy's going to have blood and guts everywhere. So we put on gowns, we get staged in, and sure enough, this guy's missing half his head but still breathing. So we had to work him, and we got absolutely covered in blood. And I'm glad we put on a gown. So that's just an example. Gowns aren't exclusively for like infectious disease, exclusively like COVID, right? Flu, meningitis. They also have a lot of value for blood and bodily fluids, like delivering a child or something like that. So just keep that in mind. So further, we'll talk about mask. This is probably an example of an N95 mask. Remember that N means that it will N, and then the 95 it protects you from 95% of pathogens in the air. So we use this for diseases like tuberculosis, influenza's flu, or COVID-19. Okay. One thing I will say that's tested occasionally: if this mask gets wet, it doesn't work. Okay, so you could see that in an exam. Oh, your mask is wet. What do you do? Replace the mask. Okay, if it's wet, doesn't matter if it's from your breath or from the rain, it doesn't work. So wet mask, no good. You got to change it out. All right. And this is a interesting device. You've probably seen these before, but basically, this is like the piece of a BVM right here. And what this is it's a one-way valve. If you don't know, when patients die, they tend to vomit. And so when you start breathing into their mouth, a lot of vomit will come out. So if you're doing mouth to mask, you want a one-way valve here to where their vomit doesn't come up into your mouth. So that's kind of what's happening here. Just be aware. Now, we don't recap. This is talking about sharps. Sharps is referring to like dirty needles, glass, stuff like that. But we don't recap needles. Okay, so just throw the needle away, get another one. Okay, put it in the sharp. I shouldn't say throw it away. Put it in the sharps container, get another one. We do not recap needles. I'll say that again. We don't recap needles. And they go in the sharps container. So these are like a hard plastic material, and they usually have like a one-way lid to where you can get stuff in there, but you can't get it back out. And they're puncture proof. So these are really good tools, and they're in pretty much every ambulance for obvious reasons. Okay. Um, so your employer can't guarantee that you're going to be 100% risk free. If you want to do that, maybe choose a different field because this is a very volatile field. So just be aware of that. But the employer should make you follow OSHA and CDC and NFPA guidelines. Okay. Um, and know your department's infectious control plan. So a lot of places they'll make you contact the supervisor, and then they'll work up the chain of command to get to your infectious control officer. But it's worth knowing that, okay? Knowing who do you call if you get exposed at 2:30 in the morning? Who do you call? What do you do? That's worth knowing. Now, infection control, it's a part of your daily routine. Now, interestingly, blood and like grossly soiled material, uh, I shouldn't jump off of this, but I will. If it's grossly soiled, it should go in one of these red biohazard bags, and then that's destroyed in a safer way, right? It goes to doesn't go into the municipal or city trash supply. It goes to a special facility that usually incinerates it, like lights it on fire, and destroys it that way. So make sure we're cleaning our ambulance after each run and on a daily basis, and then some. I can't stand a dirty ambulance. Even busy systems, there's really no reason to have a dirty ambulance. Make sure, clean up. It's like having a dirty office or a dirty bedroom. It says a lot about you with how clean your ambulance is. Okay. Now, we talked earlier about immunization, right? That's like vaccines and stuff like that. But immunity is is where you get immunized or vaccinated, right? That's immunizations or recovering from an infection. Okay, so let's use COVID as an example. If I get the COVID-19 vaccine, right, um, then I'm protected. I'm protected by it. Okay, let's say we are. And then if I get the COVID-19 infection, right, I get sick from COVID-19. I test positive for COVID-19. Then around 2 to 3 weeks after that, I'm also I'm protected, right? I have what they call antibodies, and so I'm protected. So I keep mentioning this word antibodies. So let's talk about this really quick. Antibodies are these little things that float around in the blood. And this one that I just drew happens to be specific to COVID-19 because I've had COVID-19. And so my body has these antibodies that float around. And what happens is COVID will be floating around in the blood and it happens to look like this. Okay? This is actual COVID. And this is called the antigen. Okay? Antigen is the actual bad boy. That's the COVID. That's the virus. Okay? So in this case, it's a virus. And another word for this is the pathogen. Okay? These are all synonymous. So what happens is when I have COVID-19 antibodies, well, this little guy fits perfectly on here, right? And it makes this little virus inactive. It says, "Not today, Satan," and it won't let it work. It won't let you get infected by it. So students get real lost on this whole antibody versus antigen thing. It's not too complicated. Just keep in mind, antibodies have a specific shape looking for a specific thing. So I could draw the same thing out over here. If this is the flu antigen, right? Flu, also known as influenza, and this is the and say I've had the flu shot this year, then what's going to happen is this little antibody is going to bind to this little guy, the little flu antibody that I earned after I got my flu shot, and it's going to say, no flu. You're not going to get the flu. So that's how this works. Students get the whole antigen antibody thing confused, but I hope that makes more sense. All right. So moving forward, you want to make sure that you're healthy. Receive your immunizations. Like where I work, yearly they call us in and they'll draw our titers and do our TB tests and check our records and all that. You might want to get a yearly tuberculosis skin test. You've probably had this to be enrolled in this course, but this is the test where they put a little bit of a protein up underneath your skin and see if your body reacts. If your body doesn't react, congratulations, you probably don't have tuberculosis. If your body does react, that means you've either had tuberculosis or you've been vaccinated for tuberculosis. But we typically don't vaccinate Americans for tuberculosis because it doesn't happen very often. But if someone's European or Middle Eastern, African, something like that, South American, then they do get the tuberculosis vaccine. So just be generally aware of that. All right. Now, this is our whole post-exposure management. So what do we do if we're exposed to someone, right? So we need to turn over patient care to another EMS provider. We don't want to abandon our patient and just say, "Oh, I got a little blood on me. See you later," right? Walk out the door, call someone else. No, you need to continue care and have another EMS provider take over. This might even be your partner for the time being. And then you're going to clean the exposed area. Soap and water is a really good way to do this. Rinse your eyes if necessary, obviously. And then activate your department's infectious control plan. Like I said, typically this involves reaching out to the supervisor who will reach out to the infectious control officer, and you'll go from there. Now, you may not realize you were exposed until after the call or until the hospital notifies you. So what does that mean? Okay, you run the guy who's coughing and you think, meh, nothing to see here, right? And then you get a call that night or the next day saying, "Hey, Hunter, that guy you ran, he actually has tuberculosis." And you're like, "Oh, crap." So now you got to start going through what's called your post-exposure prophylaxis, right? And that's what they're talking about right here, right? Post-exposure prophylaxis. So post-exposure means post after you're exposed, post-exposure, right? Prophylaxis. So prophylaxis means you're being proactive, right? You're trying to get ahead of this. So if you're exposed to tuberculosis, you actually will probably start taking a couple medications, which you don't even know the names of, for up to 6 months to hopefully to where that virus, it's a bacteria, won't grow. So that's an example of post-exposure prophylaxis. Okay. Um, so I want to talk about this. This is interesting. It's talking about the top 10 causes of death in the world, right? In the United States, where heart disease is really high, cancer, unintentional injuries, you can read these for yourself, but you're seeing that, heart disease is a pretty big killer in the United States. Um, so I don't have much to say on that. But post safety and personal protection. So you should begin protecting yourself as soon as you're dispatched and route to the call. You're checking the CAD notes. You're trying to gather information. Oh, homeless man who's been coughing up blood and has fever probably should put on an N95. Oh, COVID is surging and we're going to a nursing home in the COVID ward. Should probably put on an N95. You know what I'm saying? Like it's common sense stuff, but you should be preparing for this en route to the call. Okay, making sure uh, that you're wearing the proper PPE and wearing a seatbelt too. Really, there is no reason to not wear a seatbelt responding to a call. It's so dangerous. Running lights and sirens, you'll experience this. Um, and you just want to, it's just, it takes 2 seconds to put on a seatbelt. So make sure you're wearing a seatbelt. All right. There's a few things we can do on scene, like making sure the scene is well lit, placing warning devices. You want to park at a safe, convenient distance. I'll point out this fire truck. A lot of times they'll use these as blockers, right? To where if God forbid a car comes speeding through the scene, hopefully they would hit this fire truck before hitting this firefighter, and stop the vehicle. Okay. Make sure your vehicle's stable. Quick example: one time I was at when it iced really bad here in Texas, and we parked on an incline, and we got out of the truck and went into this apartment to take care of this patient. Well, the truck, because of the diesel motor, had vibrated itself down this incline into a parked car. Didn't cause any damage, but just make sure your vehicle's parked on a stable area. Not hanging off a cliff or parked on ice. So now, you do need to know about these, what's called the ERG, right? The Emergency Response Guide. It's this book. I think there's a picture in here, and there's not. Okay, make a fool of me. But it is in your book. It shows a picture. It's like an orange book, and it shows what this looks like. And just basically it'll tell you if you see like these placards, what it could mean, and like what these different numbers mean. Okay, so just be aware of that. If you see that on a rec, or if you are told that in like a clinical vignette, like a question on a test or a quiz, you need to take a step back, think safety, all right, and then work through it. But you might have to reference what's called the ERG. And I'll tell you, in the state of Texas, these are required. You have to have these in ambulances. It's required equipment. Now, a lot of times it's on our computers, but it is required. Now, while we're on this whole scene hazard thing, I want to make something very clear that we'll make abundantly clear through this lecture series. Um, is when you're doing a test, EMT students very often will get sucked into, oh, they'll give you an example like, you arrive to a scene and patient's not breathing. What should you do first? What's the most appropriate first action? Like that's a favorite way they'll say it. And you're going to be like, oh, I'm going to go over there, I'm going to open their airway, I'm going to assume C-spine position or whatever. And you're going to choose that answer and you're going to get it wrong because you didn't read all the answer choices and see that assume or assure that your scene is safe, you know? So you have to, I'm telling you now, if it says something about scene safety, about making sure you're safe, it is the right answer. Okay? So look for that on exams. Make sure you're reading all the answer choices. Because what they'll do is there will be answer choice A, B, C, and D, and something about safety will be mentioned in the bottom. And all three of these are really good choices. And being a young, excited EMT, you're going to be like, oh, it's A, moving on to the next question. And it's wrong. So it's not by chance that they usually hide these down towards choice number D. But I'm telling you, if it says something about making sure that you or your partner or your scene or your patient is safe, that's probably the right answer. So make sure you're looking at that. Safety is number one, always, 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 always on the National Registry and really in real life. but make sure you're using safety. Let me say one other thing. Love firefighters. I come from a family of firefighters. But when you're taking these quizzes and tests, I don't care if you're a firefighter or a police officer or a nurse or a physician. It doesn't matter. You are not a firefighter or a police officer when doing these. So when you're sitting down to take your quiz or test or national registry exam, you have to take off your firefighter helmet, right? You have to think, I am a paramedic, EMT, whatever. You're an EMT taking this test. It doesn't matter if you volunteer at your fire department. I think that's great. I commend you, but it doesn't matter. So don't choose the firefighter answer. Choose the EMT, AMR, MedStar, PCHD, EMS, Wise County EMS answer, right? You're choosing the EMS only answer, not your fire EMT answer, okay? So keep that in mind. Also, don't be picking your police officer answer. It's the wrong answer. So, I'm not going to read these to you. These are pretty obvious. I will say they like to ask about electricity for whatever reason on the National Registry. So if there's power lines down across the car, there you have to assume that every power line is hot until proven otherwise, and you're not the one that's going to be proving it. Okay, so just assume that power lines are hot. Okay, you're going to mark off a danger zone, and you're going to keep everyone back. We do not approach down wires ever, ever. Okay, I get fit firefighters might, or you might even think, oh, that's just a cable line, like an internet line. Doesn't matter. Lines are lines. If they're down, we don't mess with them. Someone else does. Okay. Um, lightning, of course, you want to stay away from tall objects that could hit you. Keep in mind, if we're drawing a tree here, okay, and this is you, the lightning can hit the tree, okay, and then that's fine, and then it can go through the tree and still hit you. So be aware that would be like an indirect hit. But just be aware that you don't want to be next to tall conducting objects. You really don't want to be out lightning, but you want to get as low as possible and avoid projections, right? So stay away from stuff that could conduct that electricity and hit you. Keep in mind, electricity, like lightning, it's looking for tall objects to ground itself in. So don't be the tall one in the room. So get low, okay? If there's lightning. Um, fire hazards, like again, you're not a firefighter when you do this. Just be aware of that. It's very hard for students to turn that off sometimes. But when you come up on these questions, you have to remind yourself, nope, I'm not a firefighter for this exam. You immediately after the exam you can be, but just keep that in mind. You got to turn that off, turn that part of your brain off. Now, you're talking about mass violence. Of course, this could be dangerous. I don't have a lot to add to that. I'm not going to read this to you. I will say this because this is becoming an absolute endemic in the United States is behavioral health emergencies. So again, your safety first, okay? If the patient is clenching their fist and saying they want to kill you or they are Satan, right? Whatever, you need to retreat to safety. You need to go to safety, okay? So your safety is first. Your safety is first. Your safety will be the right answer every single time. Your safety is the most important. You see what I'm getting at here? It's the same thing. It's coming up over and over again. I'm not going to explain, firefighter PPE to you, but body armor. I will say this: at the agency I worked at, we bought this. We had soft body armor. I don't know many guys that can't wear it anymore, but you're seeing this. Although I don't know of any particular cases where paramedic or EMTs have been shot in the line of duty. I'm not saying that hasn't happened. I just don't know of them. So, anyways, when you talk about stress, they go into quite a bit of detail about stress. So EMS is a really rewarding job, but it's really stressful. And quite frankly, the stress is what I love about it, right? It's like the adrenaline rush of it. That's eustress, right? Eustress is that good, like that. We're about to go to a hanging, right? And you're getting all worked up because you're like, this is gonna be good. Like I'm gonna get to help someone. I'm gonna get to use my skills, right? So that's eustress compared to distress, right? That means it's bad stress, right? You're distressed, right? So just be aware there's different stress adaptations. Your book has some really good information in there. I'm not going to regurgitate that to you today, but do read that. It is occasionally tested. They'll just straight up ask, what type of stress is associated with physical exercise? The answer is eustress. Okay, yeah, eustress. So just be aware of that, okay? Now, they want you to know there's these 3 levels of general adaptation syndrome. So we have the alarm response to stress, okay? We react and resist to stress, so that would be phase 2. And then the third one is we recover or we become exhausted. And depending on how you respond to these is whether you overcome the stress or the stress overcomes you, you know? So it's kind of obvious on that. But just be aware that the physiological signs of stress, increased respiration and heart rate. I can't wait for this to happen to you, but I remember when I was a brand new EMT, the tones would get off, like go off, and we get told there's a call, and we're about to go run lights and sirens, and I would get so excited I would shake. And it's embarrassing to admit, but it's just the truth. I love it. It was so exciting and like yeah, it's a good time, and this will happen to you. So this is your sympathetic nervous system getting real fired up. But you can combat this with like combat breathing, to where we take a breath in for 4 seconds, we hold it for 4 seconds, we let it out for 4 seconds. Try to get our heart rate back under control. And but yeah, this is just be aware when you get this type of stress response. This is the sympathetic nervous system kicking in. Your whole fight or flight response, and all these would make sense. So you could also say if we're about to go fight a bear, right? If you're about to go fight a bear, you would want all these adaptations, right? You would want all this. So you would want an increased heart rate and respirations given oxygen and supplies to your muscles. You would want an increased blood pressure, so there's lots of blood flowing in your body. You would want dilated pupils. Students get lost on this one all the time. But if you're going to fight a bear, do you want a little bit of light coming in your eyes or a lot of light coming in your eyes? Of course, you want a lot of light. You want all the light coming in your eyes so you can see everything. Your muscles get all tense. You might start sweating, getting ready. So this is all responses to stress. Okay. Now, acute stress, this occurs during acute, right? Acute means like an acute angle, right? It's a small, right? It's a well-defined stress reaction, right? So this occurs during stressful situations. So this might be like when you got to go fight a bear, or go respond to a 911 call. Delayed stress reactions, this can occur after the stressful event. So you might run like a really bad call. Let's just say like a kid shot himself or something, or a pediatric drowning or something like that. And you might have stress that happens after the call, and that would be a delayed stress reaction. And the worst one that you really got to pay attention to that's commonly missed is a cumulative stress reaction. So if I tell you, hey guys, when you finish EMT school, you have to take a cumulative exam. What does that mean? It's an exam over chapters 1 through 42. It's the whole program. So cumulative mean it's you accumulate. It's everything. So a cumulative stress reaction is everything is accumulating into a stress reaction, okay? And this is the result of prolonged or excessive stress, okay? So this is kind of where people just finally snap, okay? And this is really sad. This happens. We've all been here. So just be aware of those different terminologies. Occasionally these are all tested, okay? Now, um, acute severe stressors are sudden, severe, or unusually. I'm sorry. Let me read this again. Acute severe stressors are sudden, severe, and unusually stressful emotion. Okay, so we can see these in what's called MCIs, or mass casualty incident. This is just simply defined as an incident where you have more need than resources. So you have 10 patients and 2 ambulances. That's an MCI. Serious injury or traumatic death of a child. I'll tell you this. I worked in a pediatric hospital. Honestly, running with children didn't bother me as much as like a traumatic death. Seeing someone shoot themselves in the head, or the grandma who was on the way to the grocery store and got T-boned and killed. To me, particularly, that would actually bother. I did not like those calls. It bothered me. I'm human. I'll admit that. But these like stress reactions. So death or serious injury to a coworker, right? Injuries to a EMS provider. I've worked on police officers and stuff like that. Not the ones that were shot, the ones that were critically ill. And it gets you all riled up and stressed out, So just be aware. Now, this word's become really popular, and it should. It's common. But post-traumatic, so after some type of traumatic event, stress, emphasis on disorderly, okay? So basically, this is characterized by re-experiencing the event and over-responding to stimuli that recall the event. So the classic example is like a soldier that returns home from war, and they might hear the banging of a hammer and think that it's gunfire. And they might get undercover and be, startled, right? Like a startle reaction, or it might, scare them, or they might become dissociative, So that is like post-traumatic stress. You can also see this with like trauma, right? So you could see this in EMS, to where like, maybe you ran a really traumatic pediatric arrest, And when you hear a baby crying, it startles you and it makes you sad, and it takes you back to that call, like a dissociative reaction. So there's different ways it's manifest, okay? And it's usually from failure to resolve traumatic stress or grief, or both, but what the reason I'm emphasizing on this word disorder is we all have a level of post traumatic stress. We've all had some type of trauma in our life, big or small. And we deal with that. But the thing about PTSD is when it becomes disorderly, okay? When this disorder from this post traumatic stress keeps us from carrying out our normal daily life, okay? So PTSD might be someone who can't stand to be in public because the sound of loud noises make it to where they can't stand it, and it causes them harm, or anxiety or extreme depression or something like that. So I want to say you really, as an EMT, don't have to differentiate that. I just want you to emphasize the word disorder. I'll give you a quick example and get back on track. But we've all heard of OCD, right? Obsessive compulsion disorder. We all have obsessions and compulsions, okay? We all do. But when it becomes disorderly, i.e., it interrupts your daily life, that's when it becomes a disorder. That's when obsessions and compulsions become disorderly. That's OCD. Okay, so that's just an example of this disorder word that I keep mentioning. So we got to recognize stress. Sometimes we might see irritability towards our coworkers, friends, or family. The inability to concentrate. This is actually a really common sign of depression as well. Difficulty sleeping, increasing sleeping, or nightmares. Again, this is also a sign of depression. Sadness, anxiety, guilt, or hopelessness. Okay, loss of appetite because their gastrointestinal upset. This also has to do with stress. Stress people tend to not eat a whole lot because if you're getting ready to fight a bear, do you need to eat? No, not really. So that's why. And isolation. So they might isolate themselves. So, I've actually seen this. We've seen coworkers that go through this, and it's okay to be like, hey, man, you seem a little off. Is everything okay? How can I help you? What's up? You want to go to Chili's tonight or the Cheesecake Factory, a personal favorite, or something like that, and just check on these guys and make sure that they're okay. This is happening a lot. And you've read in your book that the risk of suicide in EMS professionals is astronomically high. Okay? It's really funny. I was talking about bulletproof vests. EMS providers aren't getting shot. Okay? They're not. Hate to break it. But they are killing themselves. And if EMS providers were putting as much effort into wearing a bulletproof vest every shift like they are, as opposed to checking on their buddy who's isolated, right, and sad and going through a divorce and can't concentrate and carry on a conversation, is telling you that they're not sleeping and having nightmares. If we were spending our time and resources checking on these people, as opposed to issuing them a bulletproof vest, where would our profession be? A bulletproof vest is $500. What if we invested $500 in mental health work for our workforce per employee? Where would we be? And that's just my soapbox, but it just really kills me that this is where we're at. And I'm not trashing the EMS profession. I want to be clear on that, but I think that there's some work to be done here. And let me say this: I will give kudos to the profession. We're moving forward in the right direction. We're recognizing this. We're teaching new EMTs like yourself about this, and we're creating workplace programs to recognize this and to respond to this, and crisis teams. And we have suicide hotlines and stuff like that. So just be aware, keep an eye out on your buddies, keep an eye out on your partner. One thing I'll say is if you work a 24-48 shift, you're going to spend more time with your partner than you will your spouse, than you will your children, than you will your parents. You're going to spend a lot of time with these people. And for the most part of that shift, you're going to be within arm's reach of your partner. And so you're going to get to know these people really well. So do watch out for them. I can't stress that enough. Watch out for your people. These are your peeps. Okay, we're all one big family here. So we have, tactics that we can do. So you can cut back on your work hours or overtime. I hate to use this word, it's nasty, but I was a bit of an overtime whore. And when I found myself not really enjoying the job as much or getting a little bit short with myself or others, I would just pull back on overtime. No more overtime. I'm just going to work my 10 shifts a month to be done. So, keep that in mind, kind of self-reflect on yourself. You may need some time off, okay? Talk about your feelings. Seek help if you need it. Reach out to others, okay? Try to adopt a relaxed philosophical outlook. That's easier said than done. Um, and minimize your physical response to stress. A big thing that I found when I got into this is I would get way too amped up, and I was doing silly things that I shouldn't have been done, like mistakes. And I finally just realized one day, like, I got to do better than this. This isn't. I'm better than this, and my stress is holding me back. And through experience and through like self realization, I was able to work through that and to where I wasn't shaking every time the tones went off. You know, you work through that. So just be aware. All right. Now, moving forward, hang with me. We're talking about this thing called CISM, right? Critical Incident Stress Management. So after a potentially like bad call, like a mass casualty incident or like a pediatric cardiac arrest or, you know, like a bad wreck with extrication or a wreck involving a first responder or something like that, you'll debrief, and this has potential to decrease PTSD. And it can be formal or informal, okay? And basically, it's where everyone, it literally looks like this, sits in a room and we talk, hey guys, what went right? What went wrong? What can we do better? How'd that make you feel? And usually these are led by like an expert, like this person maybe, that's kind of guiding the conversation. And this is how we get better and this is how we work through these problems. So these are really catching on. I'll tell you, our agency, PCHDMS, has a team that does this and they do a great job. Now, burnout, um, yeah, this happens to all of us. And this is basically exhaustion of physical or emotional strength. And this is basically where you just get burnt out. You're tired, you're done, you know, and this will happen. But we can recognize the signs of burnout and we can try to catch it before it reaches a chronic phase, okay? And this is where you start working less and taking vacations and having time off work and having hobbies outside of medicine, you know, but you might, you know, you might not desire going to work if you're burnt out. You're going to feel fatigued and irritated, even at small things. Like you might get annoyed with a patient asking for a blanket or annoyed with your partner with the way they chew their food or something like that. You know, so these are all burnout things. And, you know, you could have this feeling of overwhelming or like you're overwhelmed is a good way to describe burnout. And so you could be overeating or smoking or dipping or vaping, you know, or abusing drugs or alcohol. I hate to admit this about our profession, but you know, alcohol does happen in public safety. It's not my opinion. To where we see public safety officials and people that are really good at their job that abuse alcohol. It's really sad. So just watch for this. You know, we don't want to self medicate with alcohol. There's a difference between socially drinking and abusing alcohol. I recognize that. But just watch for your partner that's telling you that they're getting drunk every day off shift. They might need help. That might be their cry for help. They might need your help. Okay. So we can prevent, again, it's pretty much the same thing as PTSD, but, you know, take care of your own health. Try to relax, have hobbies outside of EMS. You know, don't make unreasonable demands of yourself and try to debrief after tough calls. Because what we don't want to happen is compassion fatigue. And I'm embarrassed to admit, but I will tell students so you can learn from my mistakes. I experienced this during COVID-19. We were running our asses off, and it was a really, really tough time. And we were wearing a lot of PPE, and it was scary, and we were short staffed because people were out with COVID. And you get fatigued of taking care of patients, and you have COVID or getting over COVID, and you're taking care of patients, and it's really hard. So um, just be aware that, you know, this exists. It's very similar to burnout, but compassion fatigue is when the compassion that we normally have. Compassion is the joy of taking care of others. We lose that. It becomes fatigued. We get tired of taking care of others. Would be a good way to explain what compassion fatigue is. So, you know, these can be subtle, but again, try taking time off work, trying to be philosophical, having a better attitude towards your work. Just be aware, you know, this does exist and, you know, I've had it. I don't have it anymore, but I've had it. So, I will say this doesn't give you a pass to be a jerk to patients, okay? They didn't ask for you to be fatigued. Okay, it's the demand and it's the expectation that you show up ready to work. So be aware that this isn't a hall pass to be a jerk. Now, peer support. I've talked about this. We have our crisis intervention team at the hospital district, and I'm proud of that. I'm glad they're doing that. So I will say this: if you see this on the exam, if you or a colleague express any suicidal ideations, you need to seek help. Don't let someone who told you like, oh, I'll just go hang myself or something like that. Don't laugh and shrug that off. Like that's not uh, that could be a cry for help and that needs to be explored. Okay, that's what I'll say about that. Now, uh, unfortunately, it's EMS providers again tend to do a really good job taking care of others, but not of themselves. So we want to eat a healthy diet, okay, consisting of fruits, grains, carbs, proteins, dairy, and we want to limit sugars, fats, sodium, and alcohol. Okay, didn't say you have to abstain from that, but limit them. Okay, make sure you're hydrated. When I teach paramedic school, it's kind of funny yet sad that I'll look around the room and like if I have 12 students in a class, nine of them are sipping on monsters, and it's unfortunate, but you know, I'm just letting you know. Avoid sugary drinks, okay? I don't drink sugary drinks. There's a lot of empty calories in those, and they just contribute to obesity and poor health. So, exercising is a great tool to help with your wellness. Agencies like the hospital district have gyms in our facilities that employees can use, and I think that's a great step. So I think it's good. It's a good way to experience eustress, 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 right? So it's a good way. Now, if you don't smoke or vape, don't start. Okay, nicotine's highly addictive, not good for you. Okay, make sure you're sleeping regularly. Okay, the quality of your sleep is important. This might show up on a quiz the way they're writing this. Quality is more important than the quantity of your sleep. So, good sleep hygiene, right? Don't use your phone in bed. Make sure that you're sleeping comfortably. Limit distractions, limit light, limit noise, those things that keep people from having poor sleep hygiene. Okay? Um, you got to balance your work, family, and all that life. So again, like I said, it's I've seen providers where their only thing they ever do is EMS, and like their hobbies outside of EMS is EMS, and have hobbies outside of medicine when you work in medicine. So maybe it's riding bikes and working out and going to the lake with friends or shooting guns or whatever it is you like to, or reading books that's not about medicine or whatever, or gardening, whatever it is that you like doing. Okay, so make sure you have some healthy hobbies. Now, again, substance abuse, this does unfortunately happen, but the acceptable consumption is one drink a day in women and two drinks a day in men. Um, you know, uh, of course, you should abstain from this if possible, mostly, but I'm just telling you your book's opinion, right? Two a day for men, one a day for women, okay? Why is that? Because women are smaller in size, not my opinion. In size, and their metabolism is a little bit slower. So take prescriptions. I'm not going to read that to you. It's silly. Um, I will say this. I've ran into this a lot. So remember the whole, oh, you're always within arm's reach of someone for 24 hours a day for a third of your life if you're working a 24, 48-hour shift. There's some weird people in the world, but that's okay. We overcome that by recognizing that each person is different. We communicate respectfully. We understand that cultures are different and may not be the same as ours. And diverse cultures is America, right? We're the melting pot of the world. That's cool. It's great. Um, and you have to be able to relate effectively to other cultures. Like that's fine. So this is part of being an adult. We have to work through that and realize that your partner or the person you're working for or working with for the day may not be the coolest person and nicest person you ever met, but that we're still professionals and we need to get along with them. Okay. So and realize this too. I can't stress this enough. Everyone responds to stress differently. Some people might get real anxious and stressed. Some people might start having humor. Some people might start crying. Some people might want to eat. Everyone responds differently to stress, and you need to recognize that and realize that your response to stress, although normal for you, may not and probably will not be the same response of stress of your patient, your coworkers, or families. Okay. Now, this is tested often, very often, very, very often. So make sure you understand this. Sexual harassment is the unwelcomed verbal or physical conduct of an overhead conversation. So let's talk about that. So verbal sexual harassment could be telling someone, "Hey, nice butt." Male or female, doesn't matter. Okay, you can't do that. We don't talk about that at the workplace or with patients ever. Okay, or sexual harassment by physical conduct could be slapping someone on the butt or grabbing someone's breast or something like that. It's obviously illegal and it's inappropriate, but that would be sexual harassment. or an overheard conversation. So, for example, say we're hanging out in the EMS station, and me and my partner are talking about interaction that we had at a bar this weekend, and maybe there's some crude discussion about an attractive person there. Okay, and a coworker overhears that, and they're offended by it, and it's unwelcomed. That's sexual harassment. So you got to watch what you say when you're in earshot of people. Okay. In fact, I'd say watch what you say all the time because you never know who's listening. Okay. Now, there's a certain type of sexual harassment they want you to know. It's called quid pro quo. And this literally means this for that. So the examples they'll give you is your EMS supervisor approaches you and says that if you go on a date with him, he'll give you a 50 cent an hour raise, right? So he's asking you, if you do this, I will do that for you, okay? That's quid pro quo, okay? Quid pro quo means this for that. Now, hostile work environment would be a supervisor coming up to you and saying, you know, I don't know, or grabbing you, grabbing a chest or a genitalia, that would be hostile work. You can't do that, okay? Uh, Now, it's the perceptions, okay? So it's the optics of this that really matter. It's not your intent. So again, I could say Selena Gomez is a beautiful, beautiful woman. I just think she would make a great mother or whatever. Really weird for me to say that. But what I'm saying is, I have pure intentions by saying that, but it doesn't matter. If a student or another coworker hears that, it's still sexual harassment. You can't do that. So again, just keep that out of your mouth when you're clocked in. Okay? Just don't do it. It's going to get you in trouble. 99 out of 100, you're going to get in trouble for this. So just don't do it. Keep the lines of communications open, and you have to report harassment to the supervisor immediately and keep notes, okay? So I will say this. Let me tell you this. I've worked in education for about 6 years now. I do not mess around with this. Like when, I'm not saying I've had a lot of cases of this, but like when instructors or students do this, like zero tolerance for this. And I'm telling you now, EMS agencies and hospitals have fire departments, zero tolerance for this, okay? It is just opening up a huge window for litigation. So I'm telling you, there is like a zero tolerance on this. So I wouldn't test your luck on it. Zero tolerance. Now, moving forward, there's this thing called the Kubler-Ross. The Kubler-Ross stages of grieving. Okay, and I remember this by the acronym DABDA. Okay, so that goes like DABDA. So it goes denial. So they will deny what's happening. So you could be like, I'm sorry, man, but your husband's dead. And they're going to say, no, no, he's not. No, 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 he's not. They're denying it, right? And then anger, they're mad at you. They may start trying to like slap or hit the table, like they're angry now. And then bargaining, well, please just bring him back. I'll do anything. Please bring back my husband. I will give you all my money. They're bargaining. And then depression, right? This is like prolonged sadness, more or less. And then acceptance is when they would accept the loss and their grief. Okay. Now, I want you to know this. Uh, these occur in weird stages. They don't have to occur in this order, but the word dabda helps you remember all of them. And they can happen suddenly, or they can happen like pretty much all at once, or they can happen over a prolonged period of time. And they could go from denial to anger, denial to bargaining, denial to depression, back to denial. You know what I'm saying? So there is no set prescription of how this happens, okay, or sequence of how it happens. But this is tested, okay? Um, so, you want to use special care with dying patients and family members. Ask how you can help. This is never easy to do. It's really not covered a lot in EMT and paramedic school. Uh, uh, but I will tell you this. You'll see questions where they'll tell you, patients died. You've explained which of the following would be the best ways to explain the death of this patient's or this family member to her husband. And if you see in there the phrase, I know how you feel, it's always the wrong answer. Even if you have lost a child or lost a spouse or lost a parent, it's the wrong answer. So don't choose it. We do not say we know how they feel because you don't know how they feel. Even if you've experienced a similar loss, you didn't experience the exact same loss. Um, Allow the patient and family time to grieve. Make sure you maintain a professional attitude, and make sure you're not using words like, you need to be clear in your communication with this. So I've done this a lot of times, and you just have to say, ma'am, I am terribly sorry for your loss, but your husband is deceased. He is dead, right? What you don't want to do is like, ma'am, I'm terribly sorry for your loss, but your husband has passed away or he's going to go to heaven now. And that it sounds maybe a little softer, but it's not the appropriate way to do that in the emergency setting. Okay. Um, you know, just be professional. Just, I want you to know that being clear and direct on these is the way to do it. You don't want to say, he's no longer with us, stuff like that. That's not clear enough. The words like, I'm sorry, I am terribly sorry for your loss. Your husband is deceased. So what I would typically do is like, I'm terribly sorry for your loss. Your husband is deceased. He is dead. I am terribly sorry, and we will be here with you until someone arrives to help us. And just grieve with them. I've prayed with family members before. I've hugged them. I've had people start laughing when I tell them this. This is the whole thing. I'm telling you, people grieve really weirdly. I've had people, ma'am, your husband of 40 years is deceased. He is dead. And she started laughing, and she didn't know what to do. Right, this weird emotion. It was an anxious laugh. So just be aware. People grieve differently. Okay. And what we can do is just be supportive, and we need to be direct with how we do that. We do not say, we know how you feel. Now, do not if you're working with a patient who's dying, don't make light of it. Okay. I'll tell you something that's very ominous. Dying patients know that they're dying. I've seen this. And I kid you not. When the patient who's critically ill looks at you and says, I am going to die, you better believe them. They're serious. Okay. I've had this at least half a dozen times where the patient said, oh my God, I'm going to die. And I kid you not, they died very quickly. So patients know when they're about to die. It's really sad. But when your patient looks at you with chest pain and they're sweaty and diaphoretic and they say, oh my God, I'm going to die, they mean it. So take it seriously. That's a very sick patient. So dealing with the death of a child, help the family through the initial period after the death, right? Acknowledge the fact of the death. Remember, we use clear communication on this. Do not overload the patient with a lot of information. So you don't need to go up to the patient and say, I'm sorry, man, but your patient or your child is dead. They are deceased. The next steps is the medical examiner will arrive, and a deputy with the Park County Sheriff's Office will be here to ask the questions, and then this will now be a crime scene. We're going to ask, you don't want to, you don't got to do all that right off the bat, okay? You just give them time. This is heavy, so let them process it and realize everyone processes it differently, okay? So read your room, okay? Know your audience, work through it, be compassionate, okay? There will never be. These calls are never alike. They're all unique. So you got to work through these each one at a time. Now, getting to the end, when you're working with a critically ill patient, I would always go up to people like, "Hey, my name's Hunter. I'm a paramedic with the Park County Hospital District. I'm going to be the one taking care of you today. I'm going to take really good care of you." And I've had patients that say, "Am I going to die? Am I really, really sick? Or am I going to walk again? Or something like that?" And my answer is, I'm not quite sure, but I can tell you one thing for sure. I'm going to take really good care of you. I'm going to take really good care of you. And, when there's hope, you need to instill hope in your patient. But a way that I would always phrase it when I would get those questions is, I'm going to take really good care of you. And that kind of lets the patient know that you're acknowledging that they're sick, but you're letting them know too, I'm going to help you with your problem. I'm going to do what I can. So we want to avoid sad or grim comments, okay? Again, you are going to think I'm a terrible paramedic, but I'm not. But I've walked up to calls, and I'm ashamed to admit it, so I've learned from my mistakes, where you walk up and literally the first thing in my mouth is, oh shit. I can think of this guy that shot himself in the head in a field, and he was unresponsive. But even then, like, the police are there with their body cams, and I walk up and I see him, and I'm like, oh shit. It's just a reaction, and I realize that ain't cool. I shouldn't have done that. It was a genuine response. It was a genuine reaction. But just try to keep that out of your vocabulary. I won't say what agent. I will say I ran a call pretty recently where this guy had a bad 12 lead, a picture of his heart cardiology. And the paramedic was like, ooh, that's bad. That 12 lead's ugly. And I'm thinking to myself, oh my gosh, if I'm a patient, that's not what I want to hear. You know what I'm saying? So inside voice, okay? Sometimes we think those things to ourselves. We don't have to say them out loud. Um, so, anyways, moving forward, we're going to finish this up. But uh, give the patient opportunity to express their fears and concerns. It's okay for them to be scared. It's okay for them to talk about that with you. Reassure them that you're going to take good care of them. Respect the religious customs of the patients and their needs. Like, for example, a Jehovah's Witness, they don't accept blood transfusion, and a Muslim female might not allow you to expose her skin without the presence of her husband present, things like that. So just be aware, there's different religious and customs associated with this, and their responses to pain. And just be honest, okay? If the patient asks, is my right leg missing? And it's in fact missing. Yes, sir, it is missing, but we have recovered it and we're going to transport it to the hospital with you. And we're going to take really good care of you. Like, that's your answer. It would be the wrong answer to say, nope, it's still on there. Everything's going to be fine. So you just be direct and be compassionate, okay? Don't lie to your patient. So, allow the patient to have hope, locate and notify family members, try to get them to go up to the hospital, to be there to care for the patient. So, I will say when you're dealing with a child, try to have a responsible adult, try to accompany the child. This will really put them at ease. It's exceptionally rare for you to transport a child without an adult present. Pretty much doesn't happen. So you always want the parent or guardian to be present when dealing with children. It's their comfort. It's their person they know. It puts them at ease. So I'll end on this. On uncertain situations, if it's unclear if it's a true medical emergency, contact medical control, right? That's the physician, about the need to transport. Many minor signs could be an early indicator of severe injury or illness, okay? We're not physicians. Hate to break it to you, but we're in the business of taking people to the hospital. That's what we do. So, we take people to the hospital. So if someone's to go to the hospital, for the most part, 99 out of 100, you're going to just say, take the patient to the hospital, okay? If in doubt, acquire patient consent and transport. When in doubt, the EMS is in the business of taking patients to the hospital. That's what we do. So when in doubt, we transport, okay? You're going to learn really quickly on your clinicals when you enter this profession. I mean, I don't want to put a number on it, but probably well more than half the calls we run on aren't true emergencies. And they could have waited a day or two uh, to go to the hospital or seek help. But that's okay. Okay? These people keep the lights on, right? These are the people that keep us employed. So don't get hung up on the fact of like, oh, this wasn't an emergency. Doesn't matter. You were called, okay? And you helped someone today. So that's what we're in the business of doing. We help people. So just keep that in mind. Don't get too bent out of shape on that one. But that's pretty much all I have on this one. If y'all have any questions, as always, y'all can email us. Again, this is fairly high yield information. I read the chapter. I read all the chapters, but this is a chapter in your book that is easy questions on the exam. I like to call these the gimmies. Give me those questions on the exam because they're easy. Okay, so that's it for this lecture. Thank you for your time.